talk about it.
Okay, today I'm going to be demonstrating the intradermal injection. So right now I'm at the nurse's station and I have my MAR here. So I'm going to be doing the 5 rights 3 times. So I'm going to be checking if it's the right patient, the right drug, the right dose, the right route of administration, and the right time 3 times. So I'm checking that. I'm checking my patient's room number. I'm going to enter their drawer and get the syringe with the medication. I'm going to label the syringe before I go into the patient's room with what it is and my initials and the date and the right dose. So I'm going to gather my supplies. I have my gloves, I have my gauze, and I have my alcohol swab in the injection along with my patient's MAR, and I'm going to take all of that into the room. So I'm entering my patient's room. I'm going to foam in, and I'm going to provide privacy by closing the curtain. I'm going to ask my patient his name and date of birth. So, good morning. My name's Elizabeth. I'm going to be your student nurse today. Could you tell me your name and date of birth, please?
My name is Pablo Cruz, and it's April 18th, 1997.
Okay, so I'm checking that with the MAR, and I'm checking his bracelet. Could you tell me if you have any allergies?
I don't.
He says he doesn't, so I'm verifying that with his bracelet and with the MAR, and all of that's correct. So today what I'm going to be doing, Mr. Cruz, is I'm going to give you your TB test injection. Is that okay with you? He says it's okay. He knows we're going to be doing it. So the next thing I'm going to do is check for my injection site. So I'm checking the forearm here, or I could do it in the scapula of the back. The forearm's the most common. Is that okay with you? Mm-hmm. So I'm going to have him put his forearm up here. I'm making sure that the skin is intact. Before I give the medication, I want to scan with the barcode his bracelet, beep, and I also want to scan the injection, so beep. So I've done all that. The next thing I want to do is go ahead and apply my gloves. I want to cleanse the area with an alcohol swab. So I'm going to cleanse 1 to 2 inches away from the injection site. I want to make sure I give that enough time to dry. So while it's drying, I'm going to take my syringe and needle. I'm going to take the cap off of the needle with my dominant hand. I'm going to hold the syringe like this, like a dart, with my dominant hand. We're going to assume that this has dried. I'm going to spread the skin taut. I'm going to hold it at a 5 to 15 degree angle so that the syringe is almost touching the skin. You're going to feel a slight pinch, okay? I'm going to inject the needle 1/8 of an inch in, so it's all the way up to the bevel. Once it's injected, I'm going to slide my hands to this plunger, and I'm going to inject slowly until I see a wheel appear. So I'm going to inject no more than 0.5 milliliters, which would be the dose. So once I've seen the wheel, I'm going to remove at the same angle that I came in at. I'm going to inject my safety, and I'm going to put this into the sharps container. I'm going to instruct my patient not to rub or massage or scratch the site. He says he won't. So I have my gauze here. I'm just going to lightly dab the area if there is any bleeding. Are you comfortable? Mm-hmm. He says he feels okay. So I'm going to go ahead and take off my gloves and foam. I'm going to make sure my patient is back and comfortable in bed. I'm going to make sure his 2 side rails are up, his bed is low locked, and that he has his call light in reach. So now that I've done all that, I'm going to foam one more time when I exit the patient's room. I'm going to come back to my nurse's station and document. So I'm going to draw a line through the time it was administered. I'm going to write my initials, and I'm going to document that I injected it into the right forearm.